One of the interesting observations that I have seen in my own practice in the last 4 to 5 years is the appearance on imaging of a brain which looks much older than the person whose scan I'm looking at. And I typically see these changes in people who have come to me with migraine headaches, in patients who have suffered strokes at a young age. There's a whole spectrum of neurological disorders where I see accelerated brain aging, I would say. And this typically, the brain of the patient looks like that of a person who's a decade or more older than the person he is. And there is an association with these changes that we see on brain imaging with the presence of what we call vascular risk factors, for example, undetected or sometimes detected but poorly controlled high blood pressure. Similarly, undetected or poorly controlled high blood glucose or diabetes, high blood cholesterol levels, the presence of addictions such as smoking or the use of alcohol in excessive amounts, as well as a generally unhealthy lifestyle in the form of lack of adequate activity, nutritional deficiencies, and a very stressful sort of lifestyle. So these are typically the associations we see with changes in the brain, where the brain looks like that of a person who's much older. The implications of accelerated brain aging are possibly several. It represents an increased risk for stroke, for other neurodegenerative diseases such as dementia and Parkinson's disease as a person grows older. And the interesting observation is that in people who identify the problem with their lifestyle or, for example, their metabolic risk factors and take corrective action in the form of exercise, correcting nutritional deficiencies, optimizing their intake of protein and other micronutrients, we can actually visualize these changes reversing, and the patient begins to experience a higher level of health and wellness. And that, I think, represents the essence of neurological wellness as we can understand it today.